אני מראיינת רופאים ורופאות, מטפלים, ואנשים שעשו שינוי, אנשים שהם משפיעים ומביאים שיטות חדשות של ריפוי של תזונה. היום יש לי את הכבוד הגדול לארח את דוקטור מריאלה גלאנט, שהיא רופאה אנדוקרינולוגית, מתמחה בטיפול בסוכרת. היא תספר לנו על השיטה החדשה שלה ועל הניסיון הקליני. היא תספר לנו גם כמובן על עצמה, ואולי תגלה לנו כמה סודות, תלוי כמה נהיה פה נחמדים. אז מריאלה, בוקר טוב.
בוקר טוב, תודה על הזמנה.
אני כל כך שמחה שאת כאן, אני מרגישה ממש honored, ואנחנו ננהל את הראיון בשתי שפות. מריאלה תספר לנו מאיפה היא מגיעה, והשפת אם שלה זו אנגלית, ואז ככה נעשה את זה בשתי שפות שיהיה מעניין.
וספרדית.
וספרדית?
כן,
וואו, ספרדית גם שפת אם.
כן.
מדהים.
כן.
אז באמת בואי ספרי לנו, מאיפה את מגיעה, איך הגעת לעולם הרפואה, איך הגעת לשיטה שלך וכולי, אנחנו נשמח לשמוע.
All right, so I'll switch to English, is that okay?
Okay.
As awkward as it is, it's just much nicer for the ear. So, well, like I said, I'm from Argentina. That's where my Spanish is from. I moved to the US when I was 10. My dad has type 1 diabetes. Okay. He's turning 75 very soon, but he's doing fantastic. He has type 1 since age 17, so for me, it was always a natural thing to grow up with, and therefore always part of my concern and my always paying more attention to anything to do with the endocrine system. And I guess that's how I got to be an endocrinologist, so people say, but there are many other reasons too. I just love the way the hormones, they impact and influence everything in the body. So it's I like the way it all works together. So that's how I became an endocrinologist. But more about me? That's a weird question.
איפה הקליניקה שלך? איפה את עובדת? אני יודעת שאת עובדת גם אונליין.
נכון. Well, let's put it this way. About 10 years ago, we made Aliyah. We moved to Israel. I'd studied in the U.S. for all of my studies were in the U.S. I was at Harvard and at Columbia and a lot of standard reputable places that never taught me any of the things that I'm going to tell you about.
Oh.
And then when I came here, I was a bit of an outsider, but I had worked at Hadassah in a prior time that I spent here in Israel, where I worked in clinical research for a couple of years, and then I went back to the U.S. and then came back here. And then I opened up my own clinic 7 years ago already. Kind of a mushroom here, a little bit out of the normal. I never really worked in Kupat Cholim, which is a plus and also a minus. Mm-hmm. But on the plus side, it allowed me to just do whatever I thought was best for the patient without any constraints. So that's kind of how I started getting into this whole change, this revolution that I went through.
וואו. אז עבדת בהדסה, את אומרת, בקטע של מחקר?
כן.
ושם נחשפת לדברים שונים, שלא לימדו אותך?
No, not at Hadassah. Okay. Hadassah was very much I did the regular clinic. I was in charge of the clinical trial unit, and this was years ago, and it was all the normal drugs that we use. This was very, very traditional and standard and interesting, okay, but just not what I'm doing today.
אז איך בעצם נחשפת לשיטה החדשה, הגישה החדשה שיש היום בעולם האנדוקרינולוגיה מבחינת סוכרת והמטאבוליזם של הגוף? יכולה לספר לנו קצת על זה?
Yeah, so I think it's really important to listen to your patients because they are constantly teaching us things. And what happened was that I had 2 patients at the same time send me a video by Dr. Sarah Holberg that is kind of a hero of mine. And she has this famous TED Talk that's called how to reverse diabetes by ignoring the guidelines. I'm sure you heard it.
Yeah.
And
I studied it.
and when I saw that, I was like, okay, there really is something here. And I started going deeper and deeper. But במקביל, in parallel, my best friend from childhood, her name is Jessica Apple. She and her husband both had type 1 diabetes, and they started a website, which I was also involved in, but I was kind of supervising the content, but not really. They had discovered the low carb movement way before I did. They were really, really deep into it and understood that low carb makes so much sense. And yet, while I heard her and I understood that she was right, like it totally makes sense, of course, don't eat sugar, but I didn't understand the depth of what this movement means, and it took a long time. And so really, when I understood this from Sarah Hallberg, together with what Jessica had been saying, suddenly exploded in my mind, and I was like, oh my God, this is fascinating. Let's dive in. And this is just a whole new movement that makes so much sense, and all the science is behind it. And why hadn't I been exposed to this earlier in my medical practice, in my medical studies? So this led me to like a year of reading and going through a real revolution, because what it meant is that I was now far from my colleagues and far from the medical establishment. And I was so traditional and such a typical doctor that for me it meant a huge personal revolution.
Wow.
So that took me away from being, standard, being invited to conferences, being invited to speak at drug, all the events sponsored by drug reps, etc., by drug companies, that suddenly I was not part of that world anymore. And that is a shift, right? It's a shift. And your colleagues kind of look at you a little bit weird as well. But at the same time, I always say, I took the Hippocratic Oath. My responsibility is to my patients, and this is what we do. This is where the fun really is.
מדהים. מדהים. אני גם מוצאת שהדברים הרגילים, so called, של לספור קלוריות, לאכול low fat, זה לא כל כך עובד. זה לא עבד לי על עצמי, אני רואה שזה לא עובד על אנשים, אני נותנת להם את התזונה הכי מדהימה שיכולה להיות, ואמרו לי, תקשיבי, הסוכר ממשיך לעלות ואפילו יותר, אז מה לא בסדר? ולכן אני מאוד מתחברת גם לשרה ואלייך כמובן, ואני אשמח שתספרי לנו מה השיטה בעצם ממש אומרת. יכולה לקחת אותנו ככה לדetails?
It's not about a shita, it's just about going back to eating what we ate for millions of years, okay? So it's not really about counting anything, okay? It's about understanding that once you eat what the body should be eating, then everything just fixes itself. And that means mostly meat. And I'll stop there. Okay. Yeah. I mean, I'm exaggerating because the ketogenic diet includes a lot of other things. But when I really distill it down to its purest form, when you give animal protein and fat, then everything gets fixed. This is what we see in our practice. Like over 2,000 patients that we've treated with the ketogenic diet since we started. And it's really about eating meat, chicken, fish, eggs, vegetables that grow above ground. And there's no real counting. It's more about just giving your body what it needs. And when that happens, we can talk all about the insulin, okay? But when you give your body protein and fat, and I mean real fat, not processed fat, then what happens is that you're getting the nutrition you need, and you stop searching. You stop looking for and thinking about food. And when am I going to have my next snack? And when am I going to have my next meal? And should I go to that shop to get that cookie? No, that all of these cravings go away because you're actually getting the real nutrition that you need. So this is why it's not really it's not a specific count this, count that. I'm not about that. I don't think that's a way of living in the long term. I think it's just about avoiding processed food, first of all. That's the number one thing, avoiding processed food, meaning all of the stuff that's in the middle of the supermarket that comes in a bag with all of this added sugar and seed oils just needs to go. And the minute you do that, that's 90% of the battle, actually. That's the fun part. Mm-hmm. We have to approach this differently. If you are sick and you need to reverse disease, mm-hmm. there's one method. And if you are trying to prevent disease, then I say just stay away from carbs, sugars, and seed oils, and that's enough, okay? And I mean, even you can have some carbs, I think, if you are trying to avoid just, being healthy. I think there is room for having some carbs, and such as maybe a potato or fruit, okay? Mm-hmm. But if you're looking at somebody who has already developed insulin resistance, and we can talk, like I said, but has high insulin levels, then you've got to be very strict in order to reverse this process. And therefore, it's really minimal carbs and no sugar and no seed oils.
Okay.
So,
דיברת שאם מישהו רוצה לשמור על הבריאות שלו, אז יכול להוסיף קצת פחמימות, ודיברת על תפוחי אדמה, ומה עם דגנים? חיטה, קינוע, קוסמת, כל הקטגוריה של הדגנים. מה את חושבת על זה?
Yeah, I'm not a big fan. I don't think it's adding nutrition. I really don't. And also for תפוח אדמה.
אפשר לחיות חיים בריאים, מלאים, עם תוצאות בדיקות דם הכי טובות, בלי דגנים?
Of course.
כי מלמדים אותנו שדגנים, לא מדברת על דגני בוקר שזה processed food.
Yeah, no, you're not really getting any added nutrition from דגנים. You can get everything from eggs and animal products in general.
אז בואי נדבר רגע על צמחונים וטבעונים. מה הם עושים? אם הם יש להם סוכרת סוג 2, שומן בטני, בעיות מטאבוליות, אינסולין רזיסטנט, תנגודת לאינסולין, מה הם יכולים לאכול אם הם רוצים ליישם תזונה קטוגנית?
So I really try to understand what is the reasoning behind the tzimchoni, which is a whole other can of worms, because the whole environmental issue is very, very complicated, and I think it's been oversimplified and actually wrong to look at the cows as the fault of this. What we need to look at is that I say, please at least have an egg, okay? The eggs have so much nutrition, and I've gone through some very beautiful changes in patients who have actually readopted and come to terms with the fact that their body is really craving animal protein and animal fat. Now, אפשר לעשות את זה בלי, okay? It's doable, okay? But it's very, very difficult, and you have to know how to combine in order to get those essential amino acids, those essential fats. It's not that easy. It's a lot of hard work. It's not impossible. It can be done. But I really encourage at least eggs and fish if possible. Mm-hmm. This is really, you can do it with eggs and fish. I've had some amazing results with that as well.
וכשאת אומרת שומנים, להוסיף שומנים, הדיאטה קטוגנית מדברת על כמות מאוד גבוהה של שומנים, של 70% שומן.
נכון?
איזה שומנים את מדברת? את יכולה לתת לנו דוגמה.
Butter.
חמאה, כן. שמורחים אותה על מים, אין לחם.
You can cook your vegetables with butter, okay? When you cook your vegetables with butter, it allows all the vitamins are absorbed better. You need fat actually for the fat soluble vitamins like A, D, E, K.
For hormones.
And for hormones, exactly. Shemen zayit is good for cold, okay? For cold things. So for example, for salad, no problem, shemen zait. But you want also animal fat, not being afraid of the fat in the beef, not being afraid of cooking with real fat, okay? So what I do is I use the fat from like basar tahun, you know? So I actually use this fat for cooking other things. It's very easy, very simple.
דוקטור גלאנט, אם תוכלי להסביר לנו, כי השומנים התקבעו מאוד בתפיסה של כולנו ובלימודים של הרבה אנשים שמתעסקים בתזונה ורופאים, התקבעו כמשהו מאוד שלילי, כגורם לבעיות לב וכלי דם. אם נאכל שומן רווי, שומן שמגיע מבשר ומעולם החי, זה מאיים על בריאותנו, ככה לימדו אותנו. אז למה זה התקבע בצורה הזאת? מה יש לך להגיד בעניין הזה? ואני יודעת שזה משהו מאוד שונה. אז אני אשמח לשמוע.
Well, yes, we've been confused for quite some time. We over the last, since the 1950s or so, there was a movement, especially led by one person, that changed history, okay? Sometimes that does happen in history, where a single person is very dominant in what's accepted. And what happened is that the American Heart Association was convinced that fat was really responsible for clogging arteries. And because it was a real epidemic of heart disease that started in the 50s after World War II, with a huge increase in smoking. But people didn't know that at the time, that smoking was really causing heart disease. But actually fat was blamed. And there was a controversy at the time. Was it the fat or was it the sugar? A guy named with the name of Yudkin in the UK was saying that it was the sugar, but he was really shut out. And what really persisted and what really survived was the idea that fat clogged arteries. And it was a very visual thing because they said that, you know, you could see the fat clogging the arteries in those pictures, where like a pipe being clogged. But of course, saturated fat is not solid at room temperature, and there is zero evidence that saturated fat clogs arteries in any randomized controlled trial. Yet this became the dogma. It was a hypothesis that became dogma. In 1961, Circulation, which is the journal of the American Heart Association, published a paper saying that they supported the idea that we should reduce fat in order to prevent cardiovascular disease. Again, but at the end of the article, they said that we still don't have the evidence to support this. So again, it was a hypothesis that became fact, but not really ever proven. At the end of the 1970s, the government issued the guidelines saying that we should follow the food pyramid, which suggested that which recommend that we eat carbohydrates as the base of the food pyramid. Our diet should be based on carbohydrates and minimize saturated fat. Again, no scientific solid evidence suggesting that we should do this, which means that people started eating carbohydrates all the time, and people did follow the guidelines, and they started going to the gym all the time. You know, more than ever, people tried to eat less and move more, and yet the calorie consumption just went up and up and up. Because what happens when you eat carbohydrates all the time is that you're actually hungrier all the time, because the more carbs you eat, the more insulin you secrete. And we're also telling people to eat every 3 hours, so the insulin is being secreted all the time and all the time. So anyway, to answer your question, we can talk about the insulin theory more in detail, but what happened is that we made fat the devil based on nothing, okay? Based on very unfounded studies of bad quality that have really taken, have been making people sick, okay? By avoiding saturated fat, people are getting sick.
היום שכבר כמה, 70-80 שנה אוכלים low fat, האם הסטטיסטיקה של מחלות לב וכלי דם השתנתה, ירדה? כי היינו מצפים שאם הגורם הוא שומן רווי שמגיע מהחי, שגורם להסתיידות עורקים ולמחלות לב וכלי דם, כרגע שלא אוכלים כבר 70 שנה לא אוכלים, שומן רווי, האם יש ירידה בסטטיסטיקה של מחלות לב וכלי דם?
So actually no, cardiovascular disease, people are still dying from cardiovascular disease. It's the number one killer. We still have cancer is on the rise. Chronic diseases are on the rise. Non-communicable diseases are on the rise in a very significant way. And I think that food has almost everything to do with it. Not everything. There are other factors as well, okay? No doubt about that. But what we eat plays a very big role. And we have actually decreased the amount of saturated fat that we eat. And so there seems to be no correlation whatsoever with saturated fat. And there are articles that come out about this all the time. And yet people still repeat the fact that saturated fat is clogging arteries. And I mean, that is by now really passé. There's just no evidence to support that.
יש לך מקרה בקליניקה שאת יכולה להציג לנו ולספר לנו עליו, שמישהו בא עם מחלת לב, כלי דם, כולסטרול גבוה, שומנים גבוהים, סוכר גבוה, ועשה שינוי, ורואים את זה בבדיקות דם ובאיך שהוא מרגיש?
Well, certainly. This is what we do all the time, okay? I mean, first of all, anybody who has diabetes already is a huge risk for heart disease. And heart disease is actually just a manifestation of insulin resistance, okay? It's a consequence of insulin resistance. So what do? Our goal is to lower insulin as much as possible, because what happens is that insulin is in and of itself a risk factor for heart disease. In fact, high insulin levels are the number one risk factor for heart disease, much more than LDL, for example, which is where we focused all of our energy. So our goal is to lower insulin levels so that the body can reset itself and use energy properly. When we do that, all of the major risk factors for heart disease disappear. So let's look at what they are. Hypertension, okay? Hypertension is caused by insulin resistance, okay? We have so much data to show that, and yet we keep saying that we don't know where essential hypertension comes from. But we know that when we decrease insulin levels, especially if we do that quickly and early on and not wait years and years of hypertension to occur, when we decrease the insulin, blood pressure comes down. We know that when we decrease insulin levels, triglycerides go down because we actually are able to teach the body how to use fat for energy. Now, what are triglycerides? Triglycerides is just fat that in the blood because it doesn't fit anymore into our fat cells. There's no more space to hold on to fat. So the body the cells it's just basically spilling over into the blood. That's triglycerides. Fat in the blood shouldn't be there, okay? Here's where people have made a mistake, that eating fat causes there to be fat in the blood. Wrong, okay? Wrong, very, very wrong. It's not being able to use fat that causes us to build fat in our blood. And we can't use fat when our insulin levels are high, okay? So high insulin levels inhibit us, don't allow us to use fat for energy, okay, by definition. Insulin is a storage hormone, okay, which makes us store fat. And only when our insulin levels are low, we're able to use fat for energy. So anyway, so I get derailed. So triglycerides go down. HDL, which is our good cholesterol, goes up when we learn how to use fat for energy. Sugar goes down, okay, when insulin levels go down, because we're able to finally, the only way to actually start using fat for energy is to stop eating sugar, okay? So if I stop bringing in the sugar into my body, the sugar levels go down magically, and I start to respond better to insulin. So it's very kind of complicated. Maybe we should go to the beginning. But the main factors for cardiovascular, when we look at insulin resistance and what the metabolic syndrome it's called, that actually is what leads to heart disease, is hypertension, high triglycerides, low HDL, increased waist circumference, and high sugars. And all of this, and all very significantly improve once we take sugar and carbohydrates out of the diet. And all of the markers of inflammation also decrease very, very significantly. So this is what we do in the clinic day in and day out. If you do that, okay, what you see is that the quality of the LDL also improves. Now, when I say this is a tricky subject because LDL can sometimes increase on this diet. However, the quality of the LDL is improved. And what do I mean by that? There are two types of LDL, really. There's an oxidized small LDL that is responsible and very, very leading to heart disease. Okay, it is, you can say, involved in heart disease. Okay, it's an oxidized and small LDL, which happens in the context of insulin resistance. Okay, or there's fluffy, big LDL, which is healthy and important, and it's bringing energy, and it's not responsible ever for heart disease. Now, how do I know which type I have? The problem is that in the regular lab tests, you don't see which type of LDL you have. Okay. One proxy for that is to look at your triglyceride to HDL ratio. Mm-hmm. And if that ratio is less than 1.5, okay, then there's a very, very good chance that your LDL is nice and fluffy and it does not lead to heart disease. And that's what we aim to fix. We aim to fix that ratio, so especially increase that HDL, so that it always goes together, okay? First, we decrease the triglycerides, and the HDL actually might even take 2 years to fix, okay? But that's what we want to do. We want to fix the metabolic milieu. We want to improve how energy is used, okay? With the insulin resistance means that your insulin levels are high all the time. Now, health means that you have an increase in insulin when you eat and a decrease of insulin to almost nothing when you don't eat. And this balance is key to metabolic health. So when we eat, we have a rise in insulin, and we don't eat, there's a decrease to almost 0, to an insulin level of less than 4. So when that happens, you are storing and then using, storing and then using. But when we lose that balance, because insulin levels are high constantly, which is the situation of insulin resistance, then you're storing and then storing. When you're not eating, you're still storing, okay? So that's a problem, because people are even gaining weight when they're not eating, okay? So this really frustrates people. They're like, I'm barely eating. I'm eating, a little bit of yogurt in the morning, and I'm still gaining weight. Yes, because your insulin levels are high. And people don't know that. So they're going to the gym and eating less, and yet they're still gaining weight. Now, the minute I fix this hormone imbalance by decreasing my insulin requirements, which happens when I stop eating the foods that require insulin, such as sugars and carbs, then I am able to restore this balance. And again, insulin levels are able to drop between meals, okay? That's our goal, drop that insulin level between meals. And therefore, I can restore this balance. So once I do that, all of the risk factors for cardiovascular disease improve. Okay, it's a very long-winded answer, but that's what we do in the clinic. We want to restore that balance so that insulin levels go back to being low. And when I do that, I fix all of the major risk factors for heart disease. Does that answer your question?
כן, לגמרי. זה מסביר מאוד את כל התהליך. כל התהליך של עלייה במשקל ושל אינסולין רזיסטנס, של תנגודת לאינסולין שגורמת להרבה מאוד מחלות. אנשים שצופים עכשיו, וזה מאוד מעניין אותם, ומוצאים את החומר מאוד משכנע ומעניין, ורוצים לנסות, ורוצים לדעת גם מה מצבם. מה הם צריכים לבדוק, אם זה בבדיקות דם, אם זה בדברים אחרים, מה הם צריכים לעשות קודם כל כדי לדעת מה מצבם, מעבר לאחר כך את האקשן, את הפעולות שהם צריכים לעשות. מה עכשיו צריך לעשות? כן.
So first of all, again, going back to the insulin resistance, we look at the triglycerides, okay? We want them to be less than 100. We look at the HDL. I like it when it's more than 65. Blood pressure should be 120/80. Okay, that's normal blood pressure, okay? And we want the sugar to be low and normal. We want A1C less than, 5.7 is already pre-diabetes. We don't want to get there. We want to be as close to 5 as possible. Okay, that's real health. Okay, so and you don't want to be overweight. You want your waist circumference to be normal. So belly fat is bad fat. Okay, by once I start storing fat in my belly, I'm already in trouble. okay? It means also that you have fat in your liver. But one thing you do not want is fat in your liver. So first of all, we check those parameters that I just mentioned, but also what's tricky about it is that once you start accumulating fat in your liver, it means that you've outdone your capacity to store fat in the fat cells, okay? Or that you're rapidly producing fat from fructose and also the seed oils, okay? So the fat in the liver is really, it's a huge player in insulin resistance. And the issue is that most of the time you're not going to see that in the lab test. So the normal for normal fatty for liver the normal for liver enzymes is skewed. Okay, you want your liver enzymes to be around 10 to 14. You don't want those liver enzymes to be 29 and call it okay, because it's not. Okay, it looks in the normal range, but it's not normal. Okay, and so 50% of the time people have normal liver function, but actually they're walking around with fatty liver, and about 25% of people have fatty liver and look completely normal weight and have no idea, and then they develop hypertension and they don't know why. Okay, but they're actually walking around with fat in places where they shouldn't be. Fat should be subcutaneous, should be under the skin, it should be giving us cushion. It should be a cushion. But that's it. We shouldn't be storing fat in the liver or in the abdominal area. Once we do, it's not a good sign. Okay, so one of the things you want to look at is your liver function test. You want to be looking at the triglycerides, HDL, you want to be looking at your sugar, you want to be looking at your blood pressure. These are the things that are going to alert you that maybe something is not okay.
אוקיי. לחדד טיפה את מה שאת אומרת, דוקטור גלנט. את מדברת על תפקודי כבד, ובדיקות נוספות, אבל איך שאת מפענחת אותם, איך שאת רואה מה שנמצא, מה שאני קוראת לזה בין הסוגריים, את מסתכלת על זה לפי פרוטוקול אחר.
Yes, completely.
זאת אומרת, מה שהיה לדוגמה תפקודי כבד, AST, ALT.
GGT being the most sensitive, yes.
אוקיי, אז הם בדרך כלל גבוהים, בטווח הנורמה זה גבוה, ואת אומרת שזה עדיין מסוכן גם שזה שם בטווח הנורמה.
Yes.
ונחשב כאילו לכאורה, האנשים יראו ויגידו, זה בסדר, הכבד שלי בסדר.
Right. You know, fatty liver is an epidemic that didn't exist. You know, we didn't have a name for fatty liver 30 years ago. This is a new phenomenon. Now, we used to have fatty liver when it came from alcohol, okay? Alcohol, it's called alcoholic fatty liver, and this was a well-known thing. But what started happening about 30 years ago is that patients were being blamed for drinking, and they weren't. And they were like, doctor, I swear I'm not drinking. But it was the sugar that's causing this, okay? The sugar and probably the seed oils, meaning, you know, all the...
canola, soya, shramaniyot.
Exactly. So these seed oils are also contributing to fatty liver. And this situation meant that, you know, patients getting insulin resistant and fatty liver from food, not from alcohol. And it's been changing. The normal range has been changing over time because of the whole population. Now, 30% of patients walking around with fatty liver, at least. It's a huge number, okay? This is the number one cause of liver transplant today. Fatty liver from food, okay? People are getting liver cancer from this, okay? This is something that was unheard of. This is an epidemic that we've created by the food we're eating.
אוקיי, בואי נדבר מעשית. אנשים שרוצים לאכול בסגנון הקטוגני, בסגנון שאת מדברת עליו, איך נראה יום כזה? עם מה מתחילים? מה אוכלים לברקפסט? מה אוכלים לנשנושים?
Okay, first of all, לא צריך נשנושים. Okay, when you eat this way, you don't need to snack at all. Okay, because...
כי התיאבון יורד.
Right, you're satisfied. So, I recommend starting with 3 meals a day. Usually breakfast can just be eggs, okay? Eggs with butter, maybe some vegetables with shemen zayit. If you really need, you can have some fatty cheese, okay? Lunch can be steak with salad. It can be fish with salad. It can be ktzitzot. It can be, meatballs. It can be chicken with vegetables. Same with dinner. And then after that, dinner should be very early, okay? We shouldn't eat in the dark as much as possible. We're not really meant to be eating in the dark. As soon as, eat dinner as early as possible, and that's it. Drink a lot of fluids, have a bowl of soup. This is a miracle. It's not stam, they call it the Jewish penicillin. It really, really provides all the salts and minerals in one go. And especially if you're going to start, you really need, if you're going to be starting, you really need the fluid and the salts from the get-go. Otherwise, you might feel kind of bad. Mm-hmm. One of the reasons the ketogenic diet gets a bad rep is because it takes about 2 weeks for the body to switch from a machine that uses sugar as energy to fat as energy. So they go through a transformation of an adaptation that we call the ketogenic flu sometimes. And usually the reason for this is a lack of salt replacement. We don't replace the salts the way we should. Now, insulin holds on to salt and to water, okay? And as we start the process, insulin levels go down and we lose salt and water. So at the beginning, we do lose a lot of fluids, and it's really important to replace that. And to avoid the ketogenic flu.
Okay. אז מה בנוגע לכל המוצרים שיש היום שהם קיטוגנים, לחמים קיטוגנים, שייקים, תחליפי חלבון, תוספים, ממתיקים מלאכותיים שהם בסגנון, מה את חושבת עליהם?
Look, I prefer a diet with no תחליפים, okay? I very much support trying to go as much meat, fish, eggs, liver, okay, as possible. And for most people also vegetables that grow above ground. The issue is that it's the best is the enemy of the good sometimes, and not everybody can hold such a diet. So nuts do play a role, and so does high fat dairy. I do not like artificial sweeteners, as I really feel very strongly about them. I see a very big difference in those who take artificial sweeteners and those that don't. Mm-hmm. Why? Because artificial sweeteners, they keep us addicted to the feeling of wanting, to the cravings, okay? To wanting more and more sugar. They keep the cravings alive. And one of the beautiful things that we see in this diet is that all the cravings go away very, very quickly, and we're not hungry. We don't need to be looking for sugar if we take away the artificial sweeteners. And it works on the brain and the nucleus accumbens exactly like sugar. So it makes you want more and more sugar, when the beauty of this diet is that you don't, okay? That we change that threshold. So I actually prefer just a tiny bit of sweetness instead of with real sugar instead of artificial sweeteners. As you know, from my clinic was born, do you know about this? The Eat Sane. Eat Sane was born because people were looking for bread substitutes, and they were making their bread substitutes at home or buying breads. But my feeling was that I couldn't find something that I liked the taste that didn't have artificial sweeteners. So actually, Eat Sane was born because I was looking to give the patients a chocolate that had almonds and dark chocolate in the ratio I wanted, and I couldn't find it. And anyway, this is how it evolved with Ron Hirsch, and we started playing with this, and it actually became a real company, which makes delicious low-carb food with no artificial sweeteners in it. And it's really kind of a fun process. But the idea here is not to go overboard. And I really encourage the patients to use it as a backup, okay? Mm-hmm. So no, I don't want you to be eating tons and tons of almonds and tons of cheeses. I don't like all these and I don't like all the artificial stuff that's added onto this, because in the end, that's not the goal. The goal is to go back to real food, okay? Now, sometimes you want a sandwich. Sometimes you're going to want that. So it's just a matter of quantities. Mm-hmm. Sometimes you're going to want, to have a pizza or a roll. And so it's okay to have these tachlifim, these substitutes. But it's all about the quantity, okay? So no, I don't want you to have
ketogenic cookies.
Yes, just very mamash b'mida. It has to be something that's more like a pinuk. Just something that can give you, it can give you pleasure and can give you, can save you from falling off the wagon. Okay.
וכשאת מיישמת את התזונה הזו, את מוצאת מה לאכול באירועים חברתיים, משפחתיים?
Yeah, you can always find something to eat. And, a lot of, mostly you will find something to eat. It's very rare. Maybe if you go to like a Chinese restaurant, it might be hard. Okay, so try to avoid those Chinese restaurants. Or Thai, but most of the time, because the sauces are so full of sugar, okay? But most of the time you can find something. Any Italian restaurant, you can find a good piece of meat. There almost any restaurant you can find substitutes. If you go to, for example, for sushi, you get the sashimi. Mm-hmm. If you go to a family dinner, there's always something to eat. So you don't have to be a pain in the butt. But when you do go to restaurants, what you do want to do is make sure that they don't cook the food with the seed oil. So that is a little bit annoying. You're like, can you please make those eggs with butter? So, like the breakfast we had, right? Yeah. So I am a little bit annoying about that, but I prefer to know that the eggs are cooked with butter. But you can get it done. Mm-hmm. It's not so bad.
אני יודעת שאת מארגנת בקרוב, גם השנה כנס חדש בתחום הזה. את יכולה לספר לנו עליו קצת?
Yes, we are organizing. My co-founder of Metabolics is Ariel Shitrit, and we really want to bring the message that people have power to be healthy, and knowledge is power. So this is why we really, really want people to be educated and to learn that the health is in their hands.